were part of the push to politicize and to use the terms restrict and freedom and all of this terminology that is really, I mean, vaccine mandates are quite normal. We've always had them.
The Ontario Education Minister apparently has a plan to reincorporate and reinvigorate civics into the provincial curriculum with what appears to be an underlying agenda of educating youth on how to identify legitimate information from misinformation. But what happens when the same information that the government hails as the truth turns out to be false and ends up radicalizing vulnerable people into a perpetual state of hypochondriac-riddled anxiety? Tamara Ugolini here with Rebel News, and many of you may have seen clips or watched the full debate the other night with The Agenda featuring TVO journalist Steve Paikin. It began as a one-on-one interview with Ontario's education minister, that's Stephen Lecce, who spoke about the government's plan for a return to normalcy for children attending school this fall. In one particular segment, Lecce discusses some of his government's plan to get kids caught up and how he wants to see the unions, who continually threaten to strike no matter who the sitting government is of the day. He wants them to commit to keeping children at the center of the debate to keep them in school unabated until June, which is great because Ontario saw one of the harshest and longest school closures throughout the COVID narrative than anywhere else in North America, and arguably had the strictest closure of anywhere else in the world. One of the plans that he spoke of was to reinvigorate the curriculum with a focus on skill sets and transferable skills such as coding, financial literacy, and how to budget. Included in that, evidently, is a strengthening of civics class. Here's what Lecce had to say about that.
And I like that the system of education under our government is really focusing on the skill sets that are going to help them succeed, not just when it comes to the jobs, but even the social emotional learning skills, the mental health skill sets, learning how to debate civilly. You talked about civics, learning about misinformation and the abuse of information online when it comes to creating a democratic society where young people actually know what is legitimate and what is quote unquote fake news, if I could invoke that verbiage.
I've heard it said before.
And so but those are skill sets necessary in the future of a prosperous country and a democracy.
Speaking of mis and disinformation, right after Lecce's segment, it opened with a debate set to take place between Ottawa-based family doctor Nili Kaplan-Myrth with acting medical officer of health for Haldimand Norfolk and critical care physician Matt Strauss, and Maxwell Smith, who is a bioethicist professor at the University of Western, who's mandating third boosters. No surprise, he also works at the Gavi-funded and Moderna-partnered University of Toronto's Dalai Lama School of Public Health. And as per the University of Toronto's Institute for Pandemics, yes, that is a real thing. Interestingly, Smith was also a member of the COVID-19 vaccine distribution task force. He sits on Ontario's COVID-19 bioethics table, and he also works for the Public Health Agency of Canada's Public Health Ethics Consultative Group. But here's the kicker. He also works for the World Health Organization's Ethics and COVID-19 Working Group and the WHO's ACT Accelerator Ethics and Governance Working Group. And the radicalized, hypochondriac, suffering family doctor in Ottawa diligently wore her KN95 mask alone in a room, but the pure theater and hypocrisy of this unhinged, terror-inducing supposed medical professional is on full display when she oddly picks and chooses when she should wear a mask alone inside. Apparently, it's only when she is speaking to people who have actual data to show that universal mask mandates are ineffective, as though the asymptomatic lurking COVID cooties from someone who questions the science will jump right through the screen at her. Unsurprisingly, this is what she had to say about those who long to simply return to normal.
No, so the language that you use when you say something like normal is a far-right language of anti-maskers, anti-vaxxers, and ableists who disregard the impact of COVID on seniors, on children, on educators, on essential workers, on healthcare workers, on our healthcare crisis. There's nothing normal about getting COVID, repeated infections, children and adults being hospitalized, and long COVID. There's nothing normal about taking away the protections and the proactive measures that we had to help to reduce transmission of COVID. And there's nothing normal about getting rid of any kind of isolation requirements, which would have helped to curtail outbreaks in schools, in workplaces, and everywhere else that you go.
She goes on to try to support her mask hysteria with scientific, evidence-based information. Let's look at how that went.
In fact, the state of Massachusetts in February lifted mask mandates, and any schools that had lifted mask mandates, with the exception of Boston and Chelsea, any schools that lifted mask mandates saw the transmission go up by 30%. Those schools that maintained mask mandates saw an appreciable difference in the amount of COVID that was spread within classrooms. We have the tools to use. We know what we can use. We have masks, and they should be N95 masks. We should be using HEPA filters. We should be improving ventilation. We should be providing adequate paid sick days and encouraging people to stay home when they're sick rather than returning to workplaces. We have all of those tools. They are achievable. They are low cost. They are effective. It is inappropriate to say that masks are some form of hardship. They are not. They are not cruelty, Matt. They are not in any way restricting people's ability to make friends, to play, to work, to do any of the things. In fact, there are places in the world where even, for example, in Italy, opera singers are on stage wearing masks. There is nothing that you are saying that is based in science or medicine. What you are saying is based in right-wing, anti-mask, anti-vax ideology, which has been your calling card throughout the pandemic.
All right, let's let him respond.
Sorry, I missed, you said something and then anti-mask, anti-vaccine?
Right wing, maybe?
Right wing. Oh, okay. Thank you.
Okay.
What I'm saying very clearly is you have stood with people. You were part of the push to politicize and to use the terms restrict and freedom and all of this terminology that is really, I mean, vaccine mandates are quite normal. We've always had them. School boards require that students are immunized against measles, mumps, rubella, chickenpox, meningitis. It's a normal thing. As a family doctor, every year I keep all of my patients up to date with all of their routine immunizations. If you're a doctor and you want to go to medical school, the first thing you have to do, if you're a nurse and you want to go to nursing school, the first thing you have to do is prove that you are up to date with all of your immunizations. That is just basic public health and it's basic sense.
Okay, let's let him respond.
So you've made some accusations against me that are patently untrue. I'm certainly not anti-vaccine. I've done a lot of work over the last year to promote vaccines. In the community that I've served, I've greatly increased the vaccination rate. I promoted vaccines twice during my appearance on this program. So it's really inappropriate to tag me with things that aren't true and don't represent my views or the views of science. It's also inappropriate to say that I said patently untrue things such as masks are ineffective. We can roll back the tape. I didn't say masks are ineffective. I've always worn a mask in certain clinical situations throughout my 20 years in healthcare. We want people to wear masks in appropriate settings, and we want them to wear appropriate masks. You mentioned a series from Boston, a case series from Boston that I'm not familiar with. I don't believe that data would have been randomized. I think the data that I pay the most attention to is the Bangladeshi trial, where they randomized 380,000 people to masks versus not by village, and found that there was about a 10% reduction in transmission in those villages that were randomized to mask. So it's pretty standard when we read the medical literature to privilege randomized control data, such as that Abaluk paper from Bangladesh. And a 10% effectiveness rate is not terribly effective. So yes, masks are somewhat effective, and we have to make decisions with that knowledge in hand, not the uncontrolled or unrandomized data that Dr. Kaplan-Myrth has mentioned here.
Did anyone else notice that Dr. Kaplan-Myrth looks down as if she may be trying to determine if her biased, unscientific references were actually randomized and or controlled? Can someone please page the fact checkers here? Where are they? All of this comes as emails obtained by the Epoch Times show that the Center for Disease Control, the CDC, basically colluded with Facebook, otherwise now known as Meta, to debunk claims that they thought would generate vaccine hesitancy, in some instances only weeks before formal FDA authorization of the injections that they were censoring information about. The emails show that on May 3rd, someone from Meta asks the CDC to help debunk the claim about side effects of the COVID-19 vaccine for under 5-year-olds because they believe the claims might be currently trending. This was specifically in regards to the still undetermined cause of suspiciously coincidental cases of hepatitis in children. On June 1st, the CDC responded that it is false that the COVID-19 vaccine causes hepatitis, although CDC is currently working with health departments across the country to identify children with hepatitis of unknown causes. The CDC clearly notes that the belief that the COVID-19 vaccine causes hepatitis contributes to the risk of individuals refusing COVID-19 vaccine. Then, 2 days later, Meta is once again asking the CDC to help them debunk the claims that COVID vaccines are not effective at preventing illness or death and that they may kill or seriously harm people. They removed this content a mere few weeks before the FDA authorized both the Pfizer and Moderna injections for babies, toddlers, and preschoolers aged 5 and under. There is so much in these emails that I urge you to read the article and the coinciding evidence for yourself. And then I want you to ask, should the same government who pushed censorship, colluded with regulatory bodies and big pharma to propagandize novel pharmaceuticals while using industrial strength mind control techniques to modify your behavior to gain compliance, should they be the purveyors of teaching children how to decipher what is legitimate information versus misinformation? For Rebel News, I'm Tamara Ugolini. The fallout of vaccine mandates continues to affect various sectors of our society, and new mothers are no exception. Some mothers are being forced to repay maternity benefits due to non-compliance with heavy-handed, indiscriminate employment vaccine mandates. It's why we've launched a petition and featured a full report at saveourmoms.ca. At that special website, you can view the report yourself and sign the petition calling on employers to end these useless mandates and stop coercing people into compliance, especially new moms with enough worry on their plates. That's saveourmoms.ca.